Now we will discuss about dengue. Dengue is an infectious disease and it is vector-borne disease. Here the vector is the insect mosquito. Aedes aegypti mosquito is the vector for that dengue disease. And the pathogen is virus, then 1-2 virus belonging to the type flavivirus. What are the symptoms of dengue? That is acute fever, then headache, vomiting, and a prominent symptom is pain in the eye socket. There can be decrease in platelets count, and also which that decrease in platelets cause the internal hemorrhage. Hemorrhage means lot of bleeding inside the body. So these are the symptoms. And what is the precautions we can take? As it is a vector-borne disease and mosquito is the reason, we can stop breeding of mosquito. Dengue. The word dengue is derived from African word denga, meaning fever with hemorrhage. Dengue is an acute arboviral disease caused by an arbovirus belonging to flavivirus and is primarily transmitted by Aedes mosquito. It present in 3 different forms: classical dengue fever, DHF dengue hemorrhagic fever, DSS dengue shock syndrome. It is self-limiting, sizable asymptomatic, and occasionally ending fatality. Dengue, how it spreads. Mosquito bite a dengue infected person. Then mosquito ingest blood with dengue viruses and become dengue transmission vectors. Now, this mosquito when bite person who is not vaccinated, then the person get the disease. But the mosquito, when it bites a vaccinated person, then the person never get the disease. So in this way, that dengue fever transmitted. Dengue fever is characterized by fever, rash, muscle and joint pains, and the mosquito is Aedes aegypti mosquito. What are the symptoms of dengue? Eye pain, muscle pain, bone pain, joint pain, headache, rash, nausea, vomiting, etc. Characteristics of the Aedes mosquito we should know so that we can identify the mosquito. It bites during the day. It lays its eggs in clean, shady, stagnant water. One distinct physical feature: black and white strips on its body and legs. We will now discuss about another infectious disease, that is swine flu. It's a viral disease and the pathogen is virus influenza A H1N1. And how it spreads? Infection of swine flu occurs through pigs and humans. It can spread also that means the viruses of swine flu are spread through the sweat of infected person. It is also spread through the secretions of nose, throat and saliva of infected persons. What are the symptoms? Symptoms of the swine flu are difficulty in breathing, body ache, fever, tiredness, sore throat, etc. Diagnosis of swine flu. For diagnosis of swine flu, liquid from throat of the patient is sent in laboratory. Diagnostic facilities are available in National Institute of Virology, that is NIV in Pune, and also in National Institute of Communicable Diseases, that is NICD in dengue. What is H1N1, that is swine flu? It's a type A influenza virus that affects pigs, that is swine. It can pass to humans through contact or air contamination. Human swine flu symptoms include fever, nausea, and sore throat. Reasons of infection. Infection for swine flu occurs to pigs and humans. Symptoms of swine flu: fever, runny nose, sore throat, cough, body aches, chills, vomiting. These are the symptoms of swine flu. Diagnosis of swine flu. For diagnosis of swine flu, liquid from throat of patient is sent in laboratory. Students, now we will discuss about another infectious disease, that is AIDS. The full form of AIDS is acquired immunodeficiency syndrome, which is caused by HIV. HIV full form is human immunodeficiency virus. This virus actually attacks the immune system of human being. Now the victims suffer from various diseases due to progressive weakening of natural immune. Now, what is mean by immune or immunity? Immunity is the ability to fight against diseases. Now we will discuss about the disease, how it spreads. AIDS, how it spreads. It can spread by blood products. Blood products means uncleaned needles or unscreened blood, or by mother to baby during pregnancy or labor or nursing, or another way is having unprotected sex. So in this way the disease AIDS can spread. Diagnosis of AIDS. ELISA test is used for proper diagnosis of AIDS. ELISA, E stands for enzyme, L stands for linked, I stands for immune, S stands for sorbent, A stands for assay. Assay means testing. So that is ELISA test, which is most trustable test for the diagnosis of AIDS. Treatment of the AIDS. Although there is no cure for HIV or AIDS, medications have been highly effective in fighting HIV and its complications by keeping the immune system of the patient as healthy as possible. AIDS, acquired immunodeficiency syndrome, and it is caused by HIV, that means human immune deficiency virus. What is HIV? Human immunodeficiency virus is a virus that attacks cells that help the body fight infection. There is no cure, but it is treatable with medicine. ELISA test is the most trustable diagnosis test for AIDS. Now we will discuss about another infectious disease, that is rabies. Rabies is a viral disease, and rabies occurs due to the bite of infected dog, monkey, rabbit, cat, etc. Virus of rabies enters the brain via neurons. Neurons are the nerve cells. Symptoms of rabies: fever for 2 to 12 weeks, exaggeration in behavior, hydrophobia. Hydrophobia means extreme fear of water. Rabies is a fatal disease. Fatal means which causes death. However, fatality can be prevented by timely vaccination before the onset of symptoms. Symptoms starts to appear within 90 to 175 days of dog bite. Rabies is a viral infection, viral disease. Virus transmission takes place by saliva of infected animals. 99% of human cases are caused by dog bites. The virus attacks the brain. Rabies is fatal once symptoms appear. Treatment: thorough washing of the wounds with soap and vaccine injection can avoid symptoms and save lives. Seek immediate medical care if bitten. Students, these all questions answer I have already discussed in the video, and also you will get all the answers from the textbook